So good evening again. My name is Camille McIntosh, otherwise known as Nurse, and I will be presenting this evening on water. Let us pray. Most Holy and Divine Father, we thank you, O Lord, for your blessings and for your keeping care, and for the ability that we have to share your message, to share your love with all we meet. I pray today that you may be with me, help me to explain to your students in a manner in which they can understand and see your love through this health principle. I pray that they too may open their minds and will put down resistance and understand that all you've asked them to do is for their health and for your glory. Thank you for hearing and answering my prayer. I pray in Jesus' name. Amen. As the bird by wandering, as the swallow by flying, the curse causeless shall not come. What is Proverbs 26:2 saying? What is Proverbs 26:2 saying? It is actually saying disease never comes without a cause. What is disease? Disease is an effort of nature to free the system from conditions that result from the violation of the laws of health. And that's from Ministry of Healing, page 96. What are the laws of health? Ministry of Healing, page 96 tells us pure air, sunlight, abstemiousness or temperance, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. And so we will be talking about water. The Spirit and the bride say, come. And let him that heareth say, come. And whosoever will, let him take the water of life freely. Revelations 22, verse 17. In health and in sickness, pure water provides one of heaven's choicest blessings. Its proper use promotes health. It is a beverage which God provided to quench the thirst of animals and man. Drink freely. It helps to supply the necessities of the system and assist nature to resist disease. And that's taken from page 153 of Ministry of Healing. And this is one of your required text book of reading for the course. So water is the choicest blessing to us. It is the beverage that God has provided for to quench our thirst. Not juice, water. Regulation of water balance. Our water balance is regulated by our hormone effects. Two in particularly, the antidiuretic hormone, also called ADH, and aldosterone. You also have our thirst, which is a non-voluntary mechanisms that tells us that our water intake is less than what it ought to be. Some substances that affect your water balance include your alcohol, your caffeine, and diuretic medications. Diuretic means causing to lose water. So any medication that you're taking that will cause you to lose water are considered diuretics. And these may include things like your Lasix, hydrothyroxide, that's what they use for high blood pressure and things like that. Those are diuretic medications. You can go up to 6 weeks without water, but just a few days without water. Let me repeat that. You can go up to 6 weeks without food, but just a few days without water. Every cell in the body needs water. Your body, your brain is comprised of 70% of water. Water is needed to carry oxygen throughout the cells. Water moistens your breath when you're breathing. Have you ever breathed hard on your hand and feel how warm it feels? It almost feels hot because there's a lot of functioning going on in our bodies now, and our body generates a lot of heat. So we need water to cool us down. That's how hot inside is, right? You need water to make blood. You need 83% of water to make blood. You need water to remove waste from the system. It composes of 22% of your bones. So you need water to make good bones. Who would have thought you need a liquid to make a hard substance? You need water to cushion your joints. You need water to help absorb your nutrients and to make up your muscles. 75% of water help you to make your muscles. So we truly need water for every cell of the body. How much water do we need? If your water volume is based on your weight, and usually it's calculated based on your weight in kilogram. Now, generally speaking, you will hear, have 68 glasses of water. But generally speaking, that is not correct. You need to drink water based on your weight because the more muscle mass you have, the more height you have, the more bones you have, is going to require more water. And on this table, you can see based on your weight, what your ideal water intake should be per day. Water takes up a total of 70% of our total body weight. The brain is approximately 80% water. And we're going to look again at some functions of water in the body. Essential for circulation of the blood. 90% of water is in the plasma. And we saw before that you need 83% to produce blood. So you need 83% to produce your red blood cell and 90% to produce your plasma, right? Your plasma is that liquid that your red blood cells and your white blood cells float around in. You need water to keep your temperature within a normal range. And the evaporation of water on the surface of the skin helps keep the temperature down. Winsome, you had a question? Winsome? Okay. I will move on. Water is needed to provide the fluid that constantly moistens the eyes. That means if you are dehydrated, the body is going to pull water from your eyes. So maybe the eye issue that you are having is because you are not drinking enough water. Water is needed to lubricate and cushion the bones and joints. If you are dehydrated, it means you can start having pains in your joints and, having your bones rub together because the body is going to pull water from your bones. Water is necessary for the production of saliva and digestive juices. It relieves mental and physical fatigue. Now, how does water relieve physical fatigue? Do you know that when you are dehydrated, you can't think straight? And it causes you to feel heavy and tired and irritable. So it's important that we are taking in our water. One moment. Drinking 1 glass of water every 10 minutes for 1 hour will relieve many headaches. And this is true, but oftentimes persons do not understand how to calculate water intake based on your body's weight, or how to drink their water so that they can get enough water. But we're going to look at it closely to see if water helps to flush the kidneys and alleviate some back pain. So back pain that is caused from other kind of injury or not related to water, it doesn't count. We're talking about the ones that affect the kidneys, because your kidneys are right at your back, right? That's where your kidneys are. And so if you're having problems in the kidney, you're going to have that kind of back pain around that side. Water helps to relieve constipation, right? Because when you're dehydrated, water is pulled from your feces because the body needs to keep you alive. And if you are dehydrated, then it has to pull the water from somewhere to nourish your cells. So it sounds yucky, but your body is actually taking water from feces so that it can keep you alive. So that's one more reason why you need to drink more water. You don't want the body to do that, do you? I wouldn't want that. Water reduces the risk of cancer of the colon, bladder, and urinary tract. So you can get cancer of the colon, the bladder, and the urinary tract, all because you do not drink enough water. But how are we going to get all this water in? We're going to explore this during the lecture. 3 ways in which you can get water daily: from your vegetables, from your fruits, from bathing, and also from drinking water, of course. Right? So, but these are 3 other ways that you can get it apart from drinking water. Let's look at the water content in various foods. As you might expect, crunchy vegetables contain more water than dry cereal. But did you know that potatoes contain a high percent of water? Yes. And oftentimes, potatoes have been used to pull water from things so that you can get it. So in the diagram here, you see you have lettuce with the highest concentration of water. 96% of water content is in lettuce. Then you have oranges. Cannot find my cursor. Right there. 87% is in oranges. Your baked potato has 75% water. Roasted chicken, even though we don't promote roasted chicken, right? Or your cooked beef, or your cheddar cheese. These are just, you see the water content going down with these items, okay? Water intoxication. Because drinking fluids temporarily alleviates thirst, we rarely drink to the point of overhydration and dilution of body fluids. Acute water toxicity has been reported due to rapid consumption of large quantities of fluids that greatly exceeded the kidney's maximum excretion rate of approximately 0.7 to 1 liter per hour. So what this is saying is that you hardly drink so much water that you end up passing or urinating more than 1 liter per hour. Right? So this is the maximum excretion rate for the kidneys. Right? And you hardly drink so much water that this is exceeded. So a lot of times when you begin to assess your clients, you will notice sometimes when you ask them, how much water do you drink? They will say, I drink lots of water every day. I drink lots of water. But if you continue with your investigation by saying, all right, how much is lots of water? How much bottles of water would it be? If just today, somebody came to the store and she said, I was asking her how much is her water intake among the other 8 laws of health. And she said, I drink lots of water. I said, that's awesome. Tell me, how many bottles is it? She said, about 3 or 4. So I laughed. And I said to her, my dear sister, 3 or 4, you need to double that. And probably you need to probably triple it in order to relieve your symptoms that you're having. Okay? So you can't just take a yes or a confirmation from the clients when they say that they are doing stuff. You have to further investigate to see if what they're saying is true. Sometimes they're not really lying, but it is in their mind. They think that what they're doing is adequate. And so you have to re-educate them as to what is ideal. Several years ago, some dieters over-enthusiastically followed a fad weight reduction diet, calling for massive water intake and suffered seizures from overhydration. So is overhydration possible? Yes, it is. Water intoxicity is possible, but it is not the norm unless somebody, as they said, go out of their way to drink an excessive amount of water. It's really not an easy thing to do. Approximately 10 glasses of water are eliminated daily through the body. In the kidneys, 5.5 liters is excreted. From the lungs, 2 liters. From the skin, 2 liters. From the GI tract, 0.5 liters. Now, what is 10 glasses of water? Do you know the second size water bottle? Yes, that holds like about 1.5 liters of water. That's about 10 glasses. We lose 1.5 liters of water every day to do normal functioning of our body. To blink your eyes and they don't stick together. To speak and your tongue don't cleave to your mouth. To perspire, to urinate. All right? Carla, you have a question? Carla Christie?
No, I don't.
Okay, you don't have a question. List conditions that will cause you to lose water. Now I'm going to mention these 5 and then ask you all to give me a few more conditions that will cause you to lose water. So the diabetic person, this is a condition that will cause you to lose water, because in diabetes, one of the symptoms is frequent urination. And so if you're going to the bathroom often to pee, you're going to be losing water. A person who's having a high fever is at the risk of losing excessive water, because the body, because of the fever, the body is now going to be using up water to try to cool you down so that you don't fry your brain, or because extremes in temperature can cause you to have seizures. So the body is going to try to cool you down by letting off water. You might not notice this because the fever might be there and you're hot, but the body is using water to cool you down. A person who's having diarrhea will lose water in the feces that they pass. And again, so that is excessive loss of water that can predispose somebody to dehydration. Physical hard work. Yes, if you are working hard, what's gonna happen? You're gonna be sweating more, right? And if you're gonna be sweating more than normal, yes, this is another way of losing water. Any activity that increases body sweating can cause you to lose water or more water. Now, I need Miss Daly, Kadeen Daly, can you tell me another condition that may cause you to lose water?
My idea of that would be vomiting constantly if you're feeling weak and you have a issue keeping down any form of fluid.
Exactly. Excellent. Excellent. That's an excellent answer. Vomiting can cause you to lose water. What else? Let me see those suggestions. Yes, Anne-Marie, you had the same answer, vomiting. Sister Sonia?
Yes, I have the same answer, vomiting. And
Vomiting.
also a person that is on a diuretic, they will be losing a lot of water, excessive amount of water coming from the diuretic, depending on how much milligram of the diuretic that they're getting.
Yes, that is true. Brother Patrick?
You would also lose water if you're in the sun and not properly rehydrating.
Yes? I thought you were going to say I'm not properly dressed.
No, well, I'm not getting, oh, well, me not reach to say it. But me talk about the first one with the, because when you're in there and you're not sipping your water like how you mentioned, every 10 minutes, you will be losing a lot of water.
Yes, that is true. I see Sasha Lee Harris has a point. She says crying. Yes. So if you are crying excessively or crying, you can lose water that way. Somebody said, Peaches says exercise. Hi, Peaches. I made Peaches on Sabbath. Hi, Peaches. Yes. So exercise can cause you to lose water. And from the chat, person who is coughing and spitting constantly, yes, Miss Lichmore, that is indeed a good response. Miss Porter, you can go ahead. And
yes, thank you. So a second or a third degree burn as well?
Yes, that's a good one. If you have been involved in a fire and you've lost your protection, the skin, yes, that can cause you to lose water. Excellent answer. I see Beverly Perry says runny nose. Yes. So you see now you have some children who's constantly having cold and they're constantly having runny nose. And guess what follows with that? A fever. Because they're losing fluid and it's not being replaced. And so a fever can ensue. So yes, that is definitely it. Hyperthyroidism. Yes, you can lose water with hyperthyroidism because hyperthyroidism increase the metabolic rate of the body. So the body is doing everything fast, right? So which means that it's going to use up your water intake. Miss Palmer says excessive use of salty foods. Definitely, because when you use a lot of salty foods, the kidneys are going to be stimulated to pull water from the body because of the salt. No, you're putting in the answers them too fast. I can't see. Sister Vashti, let me hear Vashti's answer while I try to catch up with these answers in the chat. Go ahead, Vashti.
I am asking, sorry, I like a question because
no problem. Go ahead.
If a person have a high hypertension, high blood pressure, and the doctor put you on water pill, is it because you're losing water?
Yes, you're going to be losing water. So it's important that you are taking in water, that you're properly hydrated. Sometimes they pull water from your system to help lower your blood pressure, right? Okay. If you have a large volume of water, which is your blood, then the heart has to pump harder to empty the bucket, which is your body, of water. So in that sense, the blood pressure goes up. So if I bore a hole in the bucket, which is your body, which is your diuretics, then there's a small little trickle of water going. So what happens is that there's less water. So there's less work for the heart to do. So in that sense, being on a diuretic or being hypertensive can also cause you to lose more water.
Okay.
You understand?
Yep.
Right. But then there's a caution. Sometimes your high blood pressure is caused from a heart problem. And there is a circulation issue. And if you drink excessive water, the heart can be affected, right? So there's a retention of water around the heart or in the system because of the circulation problem, and that in itself can put a pressure on the heart and cause the heart to stop working. And so for that reason, a water pill may be given or a diuretic may be given to try to help the heart to work. You understand? So you have to work at fixing the heart while balancing your hydration status. All right. Let me just see these answers in the chat. Drinking carbonated drinks, yes, because high sugar drink or food requires water to digest it. Now we need water for proper digestion normally, but for high sugar content food kinds, you need more water to digest these foods. Charmaine says kidney disease, absolutely correct. Persons with kidney disease will run into problem about losing water because if the kidney is not working, then you can't excrete properly. And if you have a bladder problem, overactive bladder, or a bladder infection, or a UTI, a urinary tract infection, this can cause you to lose water as well because you're going to be urinating quite frequently as a mechanism to try to fix that. Yes, bleeding is also another way that we can lose water, and we can end up in what we call hypovolemic shock because the the volume that is supposed to be inside the body has been lost by excessive bleeding, which we call hemorrhage, right? And this can cause the heart to stop working, because if the heart is supposed to be pumping fluid, which is the blood made up of 90% of liquid or water, and then there's no fluid for the heart to pump, the heart can just stop, right? So yes, excessive bleeding can cause us to lose water. If you eat plenty water-soluble fruits, you will pass a lot of urine. That is true. That is definitely true. Sister Walters, you had another answer? We have lots of bright students.
Yes, I do.
Go ahead.
Anyone with a sore foot, because it drains.
Yes. Not just a sore foot.
Any kind of form of wound.
Also,
wound
infection.
infection.
Right. A weeping wound will cause you to lose fluid. Yes, that is excellent. So you see how you have to think out of the box. Yes, leaky gut also causes you to lose water. Do you see how easy it is for us to be dehydrated? There's so many different ways. So many different ways that you can lose water. The recordings will be made available to the students. Thank you so much, Sister Sonia, for that. All right, let us continue. Let us see what are some of the others apart from what you have mentioned. Dry air. So when the weather, somebody did mention weather in the chat. When the weather is humid and the air is dry, this can cause you to lose water as well. Vomiting was mentioned. Well, we said, I don't remember if anybody said menstruation. We talk about losing blood, but not menstruation. So, but yes, menstruation can cause you to lose water. Breastfeeding, nobody said that. Yes. High protein foods, high salty foods, high sugar intake can cause you to lose water. High vitamins and supplement intake. Now, did you know that overdosing on vitamins and supplements can cause you to lose water? Because guess what? It's going to cause overworking of your kidney and your liver. That is going to have to be detoxifying the excess that you have given it, right? So this can also cause losing water. And drinking caffeine. Caffeine is a natural diuretic, and it can cause, you know what? I just remembered something. Enemas, overusage of enemas as well can cause you to lose water. The human body requires 1/3 more water than the body thirst signals indicate. So this is saying, when you begin to feel thirsty, you are at 1/3 level of your total amount of water that you need. So that means you're severely dehydrated, right? When you begin to feel thirsty. So we can't wait until we are thirsty to drink water. We have to put things in place for us to drink water. Now, lots and lots of persons are dehydrated. The fireman, because he's exposed to this heat in his regular course of duty, right? For want of a better term, the sporters, the players, they are doing these sports that require them to run up and down, netball, football, volleyball, these kind of sports that require a lot of physical activity. You will tend to lose weight, lose water. Crying, not just for the baby, but for us as adults. You've lost a loved one, or you're in pain, and you're just crying. You're heartbroken for whatever reason. that you can lose, you can become dehydrated like that. The teachers or a lecturer, why would a lecturer be dehydrated? Can anyone tell me? Can anybody tell me why a lecturer would be dehydrated? Fabulous. Talking, talking, talking. And as you talk, you are losing water by talking. So yes, so persons who you'll find that persons who do presentations, that's why you should always give the presenter a bottle of water before they start. Persons who are talking, constantly talking, lecturers, teachers, preachers, those kind of positions can be dehydrated because of the nature of their job, right? The construction worker, they too can become dehydrated because of the nature of their job. They are constantly in the sun, they're lifting up heavy equipment or tools, the materials, they're working outside. They too can become dehydrated. It's not very practical to see a construction worker with a water bottle tied onto his waist or somewhere nearby. So many times they have to wait a little while to go get water, right? And so they run the risk of becoming dehydrated. The emergency care worker, the person who's on the ambulance, the person who's constantly in the hospital or have emergency work can become dehydrated as well. Those businessmen who are constantly in meeting, again, they are talking, and because of the confines of a meeting, they can't get up as much as they would want to go to get their water. So they too are at risk. And yes, the construction worker is more likely to drink juice, so that is going to help to deplete their water intake. What are the effects of progressive dehydration? Dehydration or too little water is a major killer worldwide. Infants and the frail elderly are especially vulnerable. And do you know the elderly not many of them like to drink water either? Yes. Gastrointestinal infections are primarily responsible. So there's always a problem with the gut, right? And this increases your risk of being chronically dehydrated. Dehydration diminishes physical and mental performance. So if you're not thinking straight, if you're physically feeling out of it, it may be that you are dehydrated. As the percentage of body water diminishes, you have thirst, then there's increased thirst and loss of appetite, and some amount of discomfort. So the discomfort may be your mouth feel dry, there's no taste, things like that. Then if you are 3% decrease in water intake, the person become impatient and there's a decrease in the blood volume. If they are 4% decrease, they may have feeling of nausea or slowing down of physical work. They can't go on. They're just listless, Then there's difficulty concentrating, apathy, tingling in the extremities. This is all because of dehydration. And as dehydration persists, then you have increased body temperature. So there the fever comes on and the pulse and the respiratory rate increase because There's so much things going on in the body. There's little blood. The heart is pumping hard. The pulse rate is going to go up. The respiration is going to go up. And as the respiration go up, you end up losing more water. Then you have stumbling and you have headaches. Then there's dizziness. Then there's labored breathing. So you can actually see the person fighting to breathe. Breathing is difficult. Then the person becomes weak and mental confusion. They don't know what is going on. And then you have muscle spasms and indistinct speech. So they begin to speak incoherent. You can't understand what they're saying. And then you have kidney failure, poor circulation due to the decrease in the blood volume. Do you see how the progression of dehydration can cause death in the system? Question 13 says, list 6 symptoms of dehydration. And we have gone through some of the causes or how we can lose water. Now we're looking at the symptoms. When the body has lost about 2% of its total fluid, you have thirst, loss of appetite, dry skin, skin flushing, dark color urine, dark mouth, fatigue or weakness, chills, and head rush. And I have to confess to you, brethren, I never always drank a lot of water. Before I became a health reformer, I had an experience with water intake. I remember I was working at the clinic at the time, and when you're at the clinic, when you start in the morning and the pregnant woman coming to you, and then you have the gynae clinic going on and teenage clinic going on, not often you get a chance to tend to yourself, whether to go to the bathroom, drink water, or even to have lunch. And I think I was working there for about a month or so. And I remember one night I went home and I was not feeling well. And I fell asleep. And then I woke up in the middle of the night and I felt like I was going to die. I felt hot. I felt I was like my heart was going to literally stop. And I was wondering, what is happening to me? I thought I was having an asthma attack, but I was really wheezing. I was having difficulty breathing, but I wasn't wheezing. I was like, I don't know what's going on. And it's like the spirit said to me, go and drink some water. And I went to the kitchen and I got, there was those big bottle of water, those 1.5 liters of water. And I started drinking. And let me tell you, that bottle didn't come down until it was done. I was so dehydrated. And then looking back, I realized that I wasn't really drinking any water. And then when I did get time to eat during the days, because of the rush and there was no time, I used to just eat my lunch and then just go back to work. And I almost died. And so I made a personal pledge that this is not going to happen to me again. And at the time I was living alone and I was scared. I thought I was going to die. And so the next day I brought a bottle of water with me and I said to one of the ladies at the clinic, I said to her, I needed to help me with something. I needed to come back to me at 10 o'clock, come to me at 10 o'clock and tell me that I need to drink half of the water. And then at 12 o'clock, you need to come for the bottle of water and refill it. I really need you to do that. I had an experience last night and I almost died. And I think it's because I didn't drink any water. So please, I'm asking you to help me. And that's how I started drinking water. I did not like drinking water. I would have juice and things like that, but I did not like drinking water. And that night was a wake-up call for me. And I remember when she came to me at 10 o'clock, I did not open the bottle of water yet. And she said, sister, I'm coming back for the bottle of water. And I said, okay. And so I opened the bottle and I started drinking. I didn't know anything about taking one mouthful or two mouthful. I just drink off half of the bottle and put it down. And then at 12 o'clock when she came and the bottle wasn't emptied, I'd drink off the other half and give it to her. And she came back to me with it. But that's how I started the whole process of drinking water, right? And I didn't know much at the time, but the Holy Spirit told me that I definitely was going to die if I didn't drink any water. And I was convicted of it. And so this is how I started. Other symptoms of dehydration. Now, these symptoms will come when the body, your 5%, the total fluid loss reaches 5%, right? You're going to start off an increase in heart rate. And let me tell you, the lady that came to me this morning that was telling me that she drank a lot of water, and she was saying that she took her high blood pressure medication in the morning, and she didn't take it because her blood pressure was 100/84, she said. So she didn't take the high blood pressure medication. But she says by evening, the blood pressure was high. And she had to take her. So I said, how high was it? She said it was 160/100. So I said to her, let me show you what happened. I said, what did you have for breakfast? And she said she had ripe banana, papaya, and ripe banana, papaya. I think she mentioned another fruit. I don't remember. And then she had green bananas and callaloo. And then she had pineapple juice in that order. So I began to show her how her meal, having the fluid at the end, would have caused fermentation. Mixing the fruits and vegetables together would have caused fermentation. There was too much food kinds in her diet. She had something else, I don't remember what it was, but when we counted up there, she had oats. She said she had oatmeal sweetened with raisins. So she had about 5 different kinds of food. And I explained to her how that would have caused fermentation and would have prevented the body from getting the nutrients or even utilizing the nutrients that was there. And then by the time it reached 4 o'clock, 5 o'clock, her blood pressure was up. Again, she didn't drink any water. What she had for lunch too was steamed vegetables, quinoa, and I think that was what she had. So again, the lunch meal was impoverished, right? She didn't have any I don't remember if she said she had peas. No, she didn't have any peas. So it was impoverished. It was lacking in protein, right? No, mark you, the breakfast was a bit lacking in protein, but she will get protein from a number of the different things that she had, including the oatmeal, but not probably enough for a meal. Then when the second meal comes along, she wouldn't have had a combination of meal, a combination of protein for the entire meal. Do you understand? Right? So I showed her how not drinking enough fluid and eating, not balancing the meals, how that may have caused her blood pressure to go up. All right, so if you're 5% dehydrated, the symptoms that you will be seeing or shown is increased heart rate, increased respiration, decreased sweating, decreased urination, increased body temperature. So you're not really feverish, but you're warm. Extreme fatigue, you're feeling tired, muscle cramps, headaches, nausea, and tingling of the limbs. Miss Lichmore, you can go ahead, and then Sister Sonia. Marlene Lichmore.
Sorry.
Sister Sonia.
No, that was from earlier.
Okay. All right,
Yeah.
not a problem. Sister Walters?
Yes, Sister Nurse, I wanted to add also, like, for people who are having dehydration along with UTI, there goes into confusion.
Yes.
They get very, very confused.
Yes. And I will share an experience with you. I remember I was working at the operating theater when I was doing one of my post nursing courses, and this gentleman, middle-aged, probably about 55, if I remember correctly, he came and he did a procedure, and it just went well. He was catheterized, which means that he had a catheter through his penis into his bladder so that we could empty the urine. And he went back to the ward, and like about half an hour, they called us to say that something was wrong with the patient. So we went to the ward to see the patient at the time. And he was so confused. He was tearing off his clothes and he was fighting and doing all of these things. I was wondering, what is wrong? I said, are you in pain? And he wasn't able to answer. And so we started giving him fluids. And I was there monitoring the bag, and I'm saying, there's no urine coming out. What's going on? And the man was fighting, and we were thinking to sedate him because we didn't know what was going on. We did his vitals, his blood pressure was up, his pulse was up. And I'm saying, but we're giving him so much fluid, he ought to be passing out some urine. And there's nothing coming. So I said, okay, let's change the catheter. And when we took out that catheter and repass it, the bag full in seconds. And as the bag full with urine, the man just, he had, if I remember correctly, he had a problem with his bladder. And so they were trying to make a way for him to pass his urine. But for some reason, some blood got stuck in the catheter, so it blocked the entrance and the pee wasn't coming out. And he was trying to pee, but he was becoming dehydrated because he was losing all this fluid in the bladder and he can't pee. And the man was getting so confused, right? So yes, that can definitely, if you're having a urinary infection or you're unable to pass urine, it happens mostly to the men. It happens mostly to the men. It's very painful. That can cause dehydration as well. Kadeen Daly, you can go ahead.
Hi. My question is, when you were talking about the lady with her protein and not getting enough, if I'm going to prepare a meal and I wanted to have the full balanced diet as say as a type 2 or a type 1 diabetes, how would I measure all those stuff to actually fit it in? And then when you were talking about label, what do you when we were doing the lesson on labels,
okay, yes.
if I make a granola bar at home with, like, say, dates and some nuts and so forth, how can I actually measure all of those stuff to say I have 65 less calories or 100%?
Okay.
So those would be the question that I would like to ask as anybody that is actually sick or want to prepare something for themselves to have a proper balanced diet, and even preparing a snack to know how much protein, how much fiber, or or so you can actually add, or would you know to
Kadeen?
measure all of those?
You're the
Yes,
first
miss?
student for my advanced menu planning class. Those are excellent questions, but they're not questions for water tonight. So we will address them, but not in this class. But those are very good questions. All right, symptoms of, and you will get the answer to those questions further as we go into disease reversal. You will get answers to those questions. Symptoms of dehydration. If the person is 10%, loses 10% of their body fluid, this is an emergency, 10%, right? Help is needed immediately. The person will have symptoms of muscle cramps, vomiting, racing pulse, or what we call a thready pulse. It feels like the pulse is just, the beat is just running into each other. Shriveled skin, so the skin is all wrinkled, dim vision, painful urination, confusion, difficulty breathing, seizures, chest and abdominal pain, and ultimately unconsciousness. This is when the person is severely dehydrated. Now, a person doesn't become severely dehydrated like that, right? This takes progression. Remember when we look at the progression of dehydration in the body, it's a chronic thing over time. You're not drinking enough water, you're losing fluids through sweat or other means by your work, or you're bleeding heavily either by menstruation or things like that. And then you have another injury. So maybe you get a fever. You caught the flu on top of the fact that you were chronically dehydrated before. That will put you into problem. You have heavy menstruation, and on top of that, you met in an accident, or you got a cut or something, and then you're bleeding excessively. That will put you over, right? So severe dehydration is not a commonplace thing. It's a progression, and it's usually occurs by another injury. You understand? Not just one thing. Miss Daniels, go ahead. Go ahead.
Yes, I was wondering if you were using lots of things like cucumbers and vegetables with lots of water. Do you have to drink that amount of water by itself, or
yes?
Like sometimes I would blend like the cucumbers and tomatoes together and that type of thing and drink it. I eat a lot of vegetables with high water content.
So fruits and vegetables with high water intake or high water content will provide you with water, but not much, right? And you're going to still require water to digest them.
Okay.
So,
all right, thank you.
You might not become dehydrated because you're eating a lot of these fruits, but it doesn't mean that you are not less than what you ought to be.
Okay,
you can't use them to replace water.
Oh, so you still have to drink the required amount of water.
Yes, you still have to
daily.
drink your required amount. Remember, your required amount is not, if your required amount is 1.5 liters for the day. Remember, if you lose, if today is hotter than normal, if today you had to talk more than normal, if today you had to cry, if today something extra happened, you would be a little bit deficit. You understand what I mean?
Yes.
So, your water intake that you're supposed to take, while it's based on your body weight, it's not a constant figure. It's not going to be 1.5 every day. It's
Yes, I understand.
1.5 based on your weight. However, if the time is too hot, it needs to go up. If you're talking too much, it needs to go up. If you're crying, it needs to go up. If you're menstruating or passing a lot of fluid, vomiting, diarrhea, it needs to go up. So it doesn't stay 1.5 constantly. So if you're keeping at your 1.5 and you have increased your fruit and vegetable with high water content, you will get some water from that, but you still might need a little more. You understand? You won't go over into
Yes.
deficit, but you will still need a little more. Okay?
Okay, thank you.
All right. How do you get your daily intake of water? Everybody, when you tell them, drink more water, they say, how can I get more water in? I'm drinking, I'm gonna burst. So we're gonna teach you how to drink your water. First thing in the morning, drink at least 2 to 4 glasses of water, right? And 2 glass, in my experience, seems to be very comfortable for most persons. If you can do 4, that's awesome. But I normally tell our clients 2 glasses of water, right? 2 to 3 glasses of water. I say to them, keep a bottle of water by your bed. And when you wake up, you drink that bottle of water. Then you have your warm lemon water. And if you have stomach issues, you leave out the lemon and just have warm water. And then you have another, then I normally tell them, go for your walk, do your exercise, and then when you come back, you have another glass of water before breakfast. Then, after breakfast, this suggestion is by mid-morning, have another 2 glasses, right? But I normally tell them, after breakfast and you wait your 2 hours, you're now going to have 2 mouthfuls of water every 10 to 15 minutes. And you'll find how quickly you are able to get all your water intake. And by afternoon, you drink 2 to 3 glasses of water, and you would have gotten your 8 glasses or thereabout of water for the day. But let us look at that more closely. Let us do some, we're going to look at it, right? 2 mouthfuls at a time. The cells will absorb the water and be properly hydrated by taking 2 mouthfuls of water at a time. Gobbling down would increase the intraocular eye pressure and affect the eyes and cause one to go to the bathroom too often. So when you gobble down your water, when you take more than 2, which is 2 mouthfuls, like 4 ounces. When you take more than 4 ounces of water at a given time, the kidneys are going to be stimulated that you're having a flush. And so you're going to be sent to the bathroom in the next 20 minutes or about to pee. So your cells don't get the water. Your cells don't get hydrated. This doesn't happen when you drink juice, because juice requires water to digest it, to extract the water from the sugars. So it takes a little longer process. So you find that you don't go to the bathroom when you drink excessive amount of juice as much as if you drink excessive amount of water. But it does happen. As soon as the water is extracted from the sugar and it's a large volume, then the kidney will say time to go to the bathroom. All right. So let's do some water maths. If you do 2 mouthfuls at a time, 1 mouthful is 2 ounces. And by 1 mouthful, we mean fill your mouth with water, and you should take at least 2 swallows to empty your mouth. Now, God has designed us so much that your mouth is adequate for your body. So if you have a big mouth, it means that the amount that you take is good for your body. If you have a small mouth, your small mouth will take the amount that is required for your body. Just like your hands and measuring nuts, right? So you take 1 mouthful is 2 ounces. then 2 mouthfuls is 4 hours. If you are taking 2 mouthfuls of water every 50 minutes from 8 a.m. to 4 p.m., how much water would you take? Let's work it out. If you've had your breakfast, say 6 a.m. in the morning, and you wait 2 hours, it's now 8 o'clock. Now we're going to work it out. 8 to 1 p.m. would be about 20 times. So you have 4 hours. 4 hours, 8 to 9 would be 15 minutes. 9 to 10 would make it 8. Then by 11, that would make it 12. By 12, that would make it 16. And by 1, that would make it 20. So that's 20 chances you have to drink. And if you multiply this 20 by 40, you'll get 80 ounces of water. Do you see how easy it is to get your water in? 80 ounces of water. Now, this is calculated based on drinking water every 15 minutes, right? And this does not include your 2 glasses or 3 glasses of water that you drank in the morning as a flush. So if you do your water intake like this, your cells will definitely get hydrated, all right? How long after a meal should you drink water? And the answer is you wait 2 hours after a meal. 2 hours is sufficient time to help for the body to the digestion of the food to move from chyme to move it down into the intestine so that drinking would not affect the digestive juice or affect the liquid contents that is in the stomach. All right? So that is the reason why you wait 2 hours. Well, not me. I see somebody saying that they can't drink 2 glasses of water and then go for a walk. Not a problem. Remember, this is an example, it's a recommendation. If you can't drink 2 glasses of water because you're going to run to the bathroom to pee, then drink 1 glass, right? Drink 1 glass or drink half a glass and then wait a few minutes and then drink half a glass. The whole point of the matter is that get at least 2 glasses of water into your system before breakfast. All right. How long before a meal should you drink water? 15 to 30 minutes before a meal. However, for persons with digestive problems, always 30 minutes before a meal. So for those persons who don't have a stomach issue, you can have your tea or your juice and then wait 15 minutes to have the solid meal. For those persons who have stomach issue, you have your tea and your solid and your tea and your juice, and you wait half an hour before you have your meal. So that is the window of digestion. Okay, so that's still 1 meal, but you just need to give it time to the body to absorb the liquid content so that when you eat, the risk of you having fermentation taking place does not occur. The external application of water is one of the best and most satisfactory ways of regulating the circulation of the blood. How do we use water in sickness? Water can be used in many ways to relieve suffering. Draughts of clear, hot water taken before eating, that's like half quarter, more or less. So you drink this warm water will never do harm, but will rather be productive of good. This is from Constance on diet. So what she's saying is that if you drink a glass of warm water before your meals, that can help you, right? So drink this 15 to 30 minutes before a meal, all right? If you have fever, okay, I was going slow, giving our second presenter time to come in. So I'm going to have to now continue with my presentation. All right. If in their feverish state, water had been given them to drink freely, and applications had also been made externally, long days and nights of suffering would have been saved and many precious lives spared. So when somebody have a fever, you don't want to how do you get rid of the fever? You get rid of the fever by giving them water to drink and applying water to the body, right? So you either put them in a warm bath of water, put the foot in warm water, put on compress of warm water to the body to help lower the fever. But thousands have died with raging fevers consuming them until the fuel which fed the fever was burned up. The vitals consumed and have died in the greatest agony without being permitted to have water to allay their burning thirst. Water, which is allowed a senseless building to put out the raging elements, is not allowed human beings to put out the fire which is consuming the vitals. And I remember this vividly. I met a patient, she had a urinary tract infection. She kept getting reinfected, and she was getting it so often that after a while she stopped taking the antibiotics, and and she came down with what we call sepsis. She was an overwhelming infection of the blood. And she was in the hospital and she started to have a fever. And I remember I did her temperature and it was 108. And she was so confused. She wasn't a young girl, she was like about 26. And when I reported to the doctor, I was a student nurse at the time, and they started giving her IV fluids and giving her IV antibiotics and throwing water on her. And let me tell you something, the lady literally fried. When we put water on her, you see steam coming from her. That's how high her fever was. And she eventually died. Her body, the fever was so high, she just died. Water is the best liquid possible to cleanse the tissues, right? And I'm not too sure how many slides I have left, but the next slides will speak to your lifestyle assessment. Why do we ask the questions that we ask? Let me just quickly go through some of them. How many glasses of water do you usually drink per day? And I gave you the illustration of the questions I was asking the lady earlier. And why we ask this question? What is a good amount of water for the average person to drink? This is what is in your mind. And you want to know if she's taking in the required amount of water. Drink water until the urine is pale yellow. So this is a follow-up question that you would ask them. What color is your urine? Because sometimes they will say, "Me drink more than that." So they're not answering your question specifically. So you're going to ask a follow-up question. Okay, what color is your urine? So if they give you another color apart from pale yellow, you know that it's two things. They're either dehydrated or they're taking some medication that is being excreted in the urine that has changed the color, all right? Or probably is a supplement too. Supplements can change the color of the urine. Drink 16 to 32 ounces of warm water before awaken on the mornings. What it means that before you get up, before you start doing your daily thing, early morning when you wake, drink 2 to 3 glasses of water, or 2 to 4 glasses of water is the recommendation. This will open the appetite and prepare the stomach for digestion. The warmth will also expand the intestines and cause a nice bowel movement. See what I'm saying? We need water. What kind of water do you usually drink per day? Why are we asking this? What would you say constitutes a good, healthy water? Well, we ask what kind of water do you drink because we want to know if the cells is being properly hydrated. Drink clean, treated water. Now, you have some persons who are drinking alkaline water. We will have a presentation on that type of water, and so you will understand how deleterious it can be, how harmful it can be to the system, right? Drinking alkaline water, right? So the person should be drinking clean, treated water, not pipe water that is filled with chlorine, right? And it shouldn't be cold water. I think that's the next question. Okay, come to that. Is your water filtered? Charcoal filter removes most contaminants and makes the water taste good. So you want to know that they might be drinking water, but the water might be infected, which is going to cause them to be ill, right? So this is another question that you will ask them. What's the temperature of your water? At what temperature do you drink your water? How does the temperature of the water affect the stomach? Now, if you drink cold water causes the blood vessels that's surrounding the stomach to constrict, which means it becomes smaller. Less blood is going to the stomach because the water is cold. When you're cold, your body vessels constrict, become smaller so that heat is not lost, so that you are kept warm. And the same thing with the stomach. The cold water is going to constrict your blood vessels. And then if blood supply is not going to your stomach, that is going to impair digestion. Okay? So you want to advise them to drink water at room temperature. Cold water needs to be warmed up by the body temperature before being absorbed. So apart from it, preventing blood supply to the stomach, so the stomach won't have enough oxygen and energy to do the work of digestion. It also puts added pressure on the stomach to work to warm up the water before it can actually sit, right? Okay, so I'm going to pause here for this evening. I'm going to pause here for this evening. We'll take these two last hands and then we will move on to the next presentation. So that concludes your presentation on water. Go ahead, Anne-Marie.
Okay, hi everyone. Great evening. Thank you for allowing me to ask the question. I had typed in the chat because sometimes I keep being bumped off due to internet issue. However, let me just ask now. Oftentimes we hear that we're to drink, we're to have 2 glasses of warm water in the mornings. Some people say it's literal warm, that you like put heat to the water on the stove, and some say it's room temperature. So I want to understand, I guess for others too who want that clear understanding, what does that mean?
Okay, it is lukewarm water. It's water that has been heated.
Room temperature or
no, water that has been heated. So it's a higher temperature than room temperature water. Mark you, I've had room temperature water that was like hot water, right? But it is it's not room temperature water, it's warm water. As I wouldn't say as warm as you can bear it, but just a little bit lower than hot water, then, so to speak. All right? I think she fell off. Go ahead, Patrick.
So would I be safe to say anything to about 115 degrees Fahrenheit?
Say it again.
Would I be safe? That's why I say lukewarm water. That is the operational temperature for yeast when you're using to make yeast bread. You normally
now
have
our
that
baker
warm.
is speaking. I don't know the temperature.
Well, that's the room. That's the temperature that we use to get the sugar and the yeast. between
Activated.
110 to 115. Right. But the
Okay.
question I wanted to ask you on yeast too is vaginal yeast infection would allow you to lose water. Would I be correct?
Yes.
Okay. Have a good evening.
Thank you. All right, Brother Patrick. Yes, Anne-Marie, you're back on.
Yes, I
So the
apologize
answer,
for that.
yes, so the
I'm not
answer
sure if
was,
you had answered.
yes, I said that it's warm water, water that has been heated on the fire, for want of a better term. It's not hot water, but it's been warm. But I was also saying that depending on where you are, because I remember a summer, I don't think it was last year, it was before COVID, so it was 2020. We had a health fair in St. Catherine, and I'm telling you, the place was so hot. The water that they gave us to drink was hot. We literally had to get cool water from the fridge because the room temperature water was hot, like sun was burned, like it was in the sun, like it was on the fire. So it depends on where you are, but it is not, it's a little bit more than room temperature water.
Oh, okay.
Right?
Yes,
Yes.
thank you for that.
No problem. Okay, whoops, why so many persons putting up their hand? All right, I'm only going to take 2 more hands, 3 more hands, and that's it. Okay, go ahead, Flavia. Make your questions pointed and short.
Yes, for sure. You mentioned something about hypothyroid and
Yes.
dehydration. Could you please explain to me briefly how, because I didn't get the explanation, how they are both related?
All right. Hyperthyroidism increase your body, the rate at which your body operates, right? And so that in sense will increase your water intake, right? When we're doing hypothyroidism or thyroid, we will get more explanation, but basically that is what it's saying. The energy that is required for your body to do one act is increased. And so you tend to use up more water to do each act that you do. So that's how you can become dehydrated.
Okay, thank you so much.
You're welcome. Carrie-Ann Seymour, go ahead.
Yes, dear. Good night, everybody. I came on late, but just to be sure, you're saying that the water that we classified as room temperature, like me, I don't drink the cold. I would say I'm going for the one that's recommended. So I have been doing it wrong. The water has to be warm, like putting it to the fire or
For
not
what, in the morning?
Is it in the morning or general?
No, man, in the mornings. You are advised to drink a glass of warm water in the morning to stimulate digestion, to get as a flush. So for me, I don't like lukewarm water. So I drink room temperature water, right? I drink 2 bottles of room temperature water in the morning when I wake, right? If I'm at like Bamboo and the place is cold, then I will drink warm water at that time. But on an average, I just do the room temperature water. So the warm water acts as a cleanse, like a flush, especially if you put like half a lemon in it. It's a good cleanse for the morning. The other water that you drink throughout the day, it should be room temperature water.
All right, I understand. Thank you.
You're welcome. Sister Verona, go ahead. Sister Verona. Okay. Brother Patrick, make it short and sweet.
Yeah, very short to the point. Water that is left in buckles in a motor vehicle is not warm water to be consumed.
No, it should not be consumed because unless you have a special water bottle that is
BPA free.
Free, one, and two, that is light sensitive, which means that, you know, those canister that keeps your water at a particular temperature. Other than that, if you store your water in plastic containers that are not BPA free, you might just be drinking cancer. If your water is left in your car and things like that, exposed to the sun, it can be carcinogenic. All right, so you don't want to, and even if it is not left in the sun, water left in plastic bottles over a prolonged period should be avoided. All right?
Yeah, man.
Go ahead, Miss Young.
What if I have ginger in the water in the morning with the lemon?
Why is that?
No, I just like the taste of ginger, so I usually have
Can
ginger.
I ask you a question?
Yes, yes.
Are you hypertensive?
Yeah, yes.
Okay, so every morning you are ensuring that your hypertension stays with you, because ginger is a stimulant.
I didn't know. Thank you.
Right, so avoid the ginger. Take the cayenne out of your diet. Okay, Miss Young?
So I shouldn't use ginger, none at all? No ginger at all?
Well, if you want your high blood pressure, you can continue to use it.
No, don't say that. I'm just trying to know.
It's not that you shouldn't use it, none at all. But it is a stimulant. It is supposed to be used as a medicine, not food. Right? Okay. So if you like the taste of ginger, and so you take it out of your water, but you put it in your rice and peas, you are still hurting yourself. So I would say for you, eliminate the ginger until your hypertension is fixed.
Okay.
In the case of an emergency where you're having a stomach problem or something happens and you need a ginger and you're using it as a treatment, that is different. But for now, eliminate the ginger from your diet.
Thank you.
You are welcome. So without further ado, I cannot take any more hands. We are going over time and we want to finish the other presentation timely for this evening. So I'm not going to take these three lovely, imagine, I'm 3 favorite people to, you know, I'm not going to be taking your hands. I'm so sorry. I'm going to be closing now so that we can start the next presentation. But just message me in the chat and I'll be able to answer while the next presentation is going. So I'm going to close with prayer now. Let us pray. Most holy and divine Father, we want to thank you so much for helping me to present this presentation so much that your people are able to understand, to make them more healthy, so that you are now able to speak to them and talk with them so that they can be better Christians and better persons for your kingdom. Thank you. In Jesus' name I pray. Amen. Thank you so much, everyone, for participating.